Want to make a difference in geographic fields? Volunteer with the North Star of GIS and help build a racially just geography for a racially just world. Sign up now at northstarofgis.org/volunteer.
Be Black. Be bold. Be innovative. Show the world equitable geo.
We're coming together as a collective to celebrate people of African descent, the diaspora, and talking about geospatial equity and justice.
You're listening to the North Star Gaze, a podcast with intimate stories from geo luminaries. Okay. Welcome back to another episode of the North Star Gaze. And this is the second episode in our series on GIS and health. In the last episode, we gave you a chance to meet Johnnie Chip Allen, who's with the Columbus Department of Health. And as you heard in that episode, Chip has really a tremendous background in speaking about social determinants of health and how they relate to health equity and eliminating health disparities, which is not the same thing. If you did not listen to that last episode, I'm going to ask you to go back and take a listen to it because there was a lot of great information covered there. Chip invited Rexford Dwamena, who is our guest for this episode on GIS and health. Rex and I met some years ago at an event, I believe, with the APHA, but Rex is another shining star in the public health arena. He's a graduate of the Eastern Virginia Medical School with his master's in public health, and he has been a longtime user of epidemiological methods and procedures, statistical techniques, and research designs to identify high priority areas by applying geospatial techniques. So if there's anybody that we needed to have on this episode of the North Star Gaze, it's Rex. And get ready for an interesting conversation between Rex, myself, and Johnnie Chip Allen. Rex, do you want to just take a moment to tell us a little bit more about the work that you have been doing in your capacity at the Virginia Department of Health?
Absolutely. Thank you very much for inviting me to this podcast. And I'm glad to be here with Chip, who I've been working with for a long time to address health equity and health disparities. I've been in the Virginia Health Department for the past almost 20 years, and all the 20 years I've been using GIS. So I do more of data analytics, data management, data modeling using GIS, and also do more of a policy, how to address health disparity in the state of Virginia or in the Commonwealth of Virginia. So my work has been Office of Health Equity. In fact, I was once the acting director for the Health Equity, Social Epi, and a lot of my work has been published. And I'm glad to be here, and then hopefully I can impart some ideas this evening.
Thank you so much for that. Chip, do you want to pick up?
Yeah, first of all, hello, everyone. I'm so glad to be with you, Erica, again for this important conversation, but also with Rex. Rex's work has really fundamentally changed how I do health equity work, how I did it in the state of Ohio. And then I took the things that I learned from Rex and took them to the national level when I was a contractor at CDC, so much so that I asked Rex to be on a national project with me because of his expertise. So I can't say enough about this gentleman in terms of his brilliance and also his commitment to equity and using data. And so I'm really excited about this podcast.
Fantastic. So, Rex, can you tell us what first attracted you to geospatial technology, and when did you realize that it could become an important part of your career? Did you start as an epidemiologist?
Yes, I did. In fact, when I was in graduate school, I happened to be doing my master's in the Eastern Virginia Medical School. I was a research assistant for the dean of the school. And I'll never forget this. He came to me one time and said, "Hey, Rex, I just purchased this tool. I don't know what it is. Can you just figure out what it is and what it can do?" So I took I had to bend the midnight oil to study what it is and what the GIS could do. That was my first time ahead of GIS. That was in 2006. So I spent the night reading about GIS, went to YouTube and stuff, and then I was able to make my first map of that day. So that I fell in love with GIS because I was able to put my own address on the map. I could relate to the address and the point on the address. Oh, this is where I live and what the streets. So I fell in love with that. So my experience stemmed from that. And then I took it to the next level, not just mapping, also by doing the modeling, by using it to do a spatial analysis and stuff like that. So when I got to health department, I used this what I've learned in graduate school to actually also take it to the next level by doing the small area estimates using GIS and stuff like that. So my experience has stemmed from graduate school up to now. And since that time, I've been using GIS every day, and I mean it every day.
Anything you want to add to that, Chip?
Yeah. So the thing is, Rex, when did you really begin to start thinking about how to use GIS to help address the issue of disparate health outcomes? What made you just really start thinking this would be a good technology to really even advance health equity?
Right, Chip. Thanks for the question. But when I got to health department, I had a boss who died about 3 years ago. May his soul rest in peace. I'm just cashing in the legacy of his work. He had attended a course on GIS. So when I came in the Office of Health Equity, I was given a project to look into breast cancer incidence in Virginia. So I was able to use GIS to be able to map the incidence rate and also use other variables to triangulate the breast cancer data using GIS. So by then, I was able to show how the proximity to all the mammography or mammogram services was very important in addressing breast cancer. So at that time, the office decided, oh, wow, we can use GIS to do stuff like this. So let's invest in the product. So they bought me my first GIS software at that time. So the health equity aspect came in because I was working in the Office of Health Equity. We had to show disparities and we have to show the areas where we should be targeting to address this disparity. So it has been a milestone for me, and I've learned so much for doing that, and I've continued to do that.
I want to ask a follow-up question. As a result of that work on identifying geographic incidence of breast cancer, did the Department of Health expand access to mammography? What did they do as a result?
Absolutely. So when I did that, I told my boss said, oh, hey, there was a new hospital. They intend to build a new hospital in Fredericksburg. And I said, why? And he said, oh, because they found a higher breast cancer incidence in that area. I said, well, that is a good thing. If we are finding them in that area, so breast cancer incidence is good. It's not bad. It's good. But rather, let's focus our mind on where we have low incidence and high mortality rate. And guess what that was? That was the rural areas. So by then, my boss was able to work with the VCU to be able to do mammography in these rural areas. And according to that time, 2009 or 10, within a month, they were able to find women in those areas who were having breast cancer that were not diagnosed. So underreporting was an issue because of access to care. So based on that study, we work with other stakeholders to take the mammography machine to these rural areas to diagnose the so that's a policy aspect of what came out of that project. And I'm very excited about that. But a student in Virginia Tech did a study on that, and they realized that what we were saying was true. So the women in those areas were not going in for screening. And as a result, the higher rate of late stage and a lower rate of incidence. So that's how we were looking at the data.
That's brilliant.
So Rex, I'm thinking about this thing. We talk about GIS. Most people don't understand that it means geographic information systems, right? We just kind of, sometimes assume that if folks understand that. But just kind of following up with something else that Eric had mentioned, you have worked in government for years and you've had a number of different roles, and you've used this technology in a lot of different public health operations. So can you kind of explain to us, how do you get decision makers, policy makers, stakeholders who don't have a GIS background? How do you really get them to understand how to use and interpret this really complex set of tools?
Good question, Chip. When we do any project in the health department, we try to do dissemination of the information. So we do presentations to our stakeholders. Remember, we work in the government and we health department. We cannot lobby for policy, but we can work through our stakeholders to be able to take the data and run with it. Every report that we produce, we don't come out so strictly about the policy, what they should do, but we tell them what could be done to address what we have done, and it seems to work in Virginia.
Invest in racial equity in geography. Your donation to the North Star GIS fuels scholarships, mentorship, community-driven initiatives, and more. Give today at northstargis.org/donate.
I think most people really have a limited understanding of what happens in their public health department. But maybe you can talk a little bit about how a public health office works, right? How does it work? And how does GIS support the main things that the Virginia Department of Health is trying to do? Where are the main areas where GIS is supporting the work of Virginia Department of Health?
Good question too, Erica. How Virginia is structured in such a way that we have the central office and we have 35 local health districts. And for every health district, we have an EP at every health district, not excluding even those who are also analysts. So every one of them has invested so much money into GIS that every individual who wants to learn how to do mapping or GIS could get a license to do whatever they have to do. But guess what? The Office of Health Equity is known for doing more of complex and sophisticated analysis. We don't just do mapping, we do more of analysis. So when people need very complicated stuff to be done, they come to us. They come to the Office of Health Equity. But if you just want to do mapping, most people can do mapping. And the Office of Health Equity is a top on the line based on the work that we do. And also, so the Health Department has really invested so much money to what we do, and we continue to do that to help the state.
Let me follow up on that, Rex, because one of the things that you're known for is the Health Opportunity Index. And I'm so excited about that work because you helped me do it in Ohio. And you talk about complex analysis. And I'm thinking about, for example, we think about how GIS can help in the understanding of social determinants and community risk levels. So what is the Health Opportunity Index? And how have you used that to really help people understand the importance of identifying specific social determinants of health as opposed to guessing which social determinants of health might be contributing to health disparities and health inequities?
Sure, Chip. And I'm glad that you brought up the Health Opportunity Index, which is AKA HOI. So I'll give a story about that, okay? When I came to Health Department in 2008 or 7, my boss asked my boss, I said, my dad worked for United Nations. And if he had told his boss that he was going to reduce poverty by 50%, and for 50 years, the same area that we identified is still poor right now, he won't have a job. He would have lost his job. So what he said, so I said there has to be a way to address this disparity in areas that they said, Rex, what do you think? I said, well, because most of the analysis that we do is at the higher level, which is the county level and state level. Now, I'll give an example. We go to Fairfax County, the poverty rate in Fairfax is about 6%. However, if you disaggregate the data, at the census tract level, there are some pockets within Fairfax that have about 18 or 20 or 25% poverty rate. So that's why we decided to do HOI at the census tract level. So we term the census tract as the neighborhood. So we're able to use those variables to construct an index that will say, oh, it's heuristic. It will say, okay, look at this area. Look at this area. We might not be able to tell you the whole story, but if you map the composite index, it will direct you to the area where you should be looking. And then you triangulate those indicators with your outcome to see what the drivers are in that area. It does not answer all the questions, but at least it points you to the direction where you should be looking. And we are able to address a lot of issues in Virginia using the HOI, able to target the population, able to address what people are going through in rural areas especially, and also the urban areas to see if what indicators should we be focusing on. We have 13 indicators. We don't need all the 13. We just have to need those that are prominent in that area that we need to be addressed. And HOI has done that job for us. When it comes to HOI, everybody in the health department uses the tool to be able to assess or to evaluate their programs because it tells them it's more actionable, tells them where they should be looking in the state or to address health disparity. And the HOI does exactly that. So I'm glad that it has been a work that I will not regret, and we keep on doing that. I hope there's something out there that can challenge HOI.
This is fascinating. I've heard you, Chip, talk about the Health Opportunity Index, the HOI, but what I hear is that the HOI can actually help uncover an issue. So if you think that the poverty level for the whole county is 4%, you might think, I don't need to do anything in Fairfax County.
Exactly.
But when you go down to those lower levels of geography, it actually can reveal something that would not have been revealed otherwise, if I'm hearing you correctly.
Absolutely. And I used to tell my students, I said, look, at this aggregation and aggregation of data, they are not linear transformation. So you can't say that because a county is 4%, everybody in that county is 4%. But at the census tract level, you will find the pockets. And the HOI is able to do that because the HOI is at the census tract level. So we're able to identify those neighborhoods and then we evaluate their health outcomes. We are not saying that every area that has a lower HOI has a poor health outcome. That's a good thing because we can find out what are they doing right that, what you expect is not happening. So the HOI takes it to the area where we should be looking. We should be paying attention to target. It could be education, it could be employment, it could be transportation, it could be housing, and those things. So that's why I say it's a DNA of the area. So maybe DNA, housing DNA might not be prominent, but maybe education is the problem that we need to address, stuff like that. Yeah.
So, and that's the beauty of the HOI. And that you talked about, we have 13 social determinants. And then because the HOI is built on the statistical analysis first of all, it gives you an overall measure of health opportunity, which is that composite index. But the thing that really excites me about the HOI is that you can have 13 social determinants, but it may be only 2 that based on the statistical analysis say you should pay attention to. It doesn't say those other things are not a problem, but it allows you to focus on, let's say, if it's employment access or if it's healthcare. You don't have to be sitting back and thinking about which other 10 having an effect. And that is the beauty of it. And I think that's what helps really me and my health equity work because, there are a lot of composite indices out there that are geographically referenced, right? So there are a lot of composite indices, but not all of them are built the same. And so one of the things that I have done with your help, actually you and Erica are responsible for some of the things that I do in GIS. Now, Erica has this saying, I call it the health equity golden rule, but it's really the Erica Phillips rule because I learned it from her. And when you're trying to think about using data, one of the things that Erica has been very instrumental in my GIS journey is she'll say, Chip, before you start using this data, you need to figure out what decisions are you trying to make or what questions are you trying to answer. And then she has me write these things down. And so based on what you're saying, if we're talking about using the Health Opportunity Index, if we really, for example, want to know using her rule, hey, what question do I want to answer? One of the questions could be that in the area that I know that I have, for example, high coronary heart disease or high HIV or high infant mortality, I can have all of those conditions at the highest levels in the same neighborhoods, right? But I may not have a sense of what's driving that. And from what you're saying, the health opportunity can give us insights in what social determinants do we need to look at that might be really responsible for driving a number of different health conditions out of control. And that's the biggest thing that I learned from both of you all. Yeah. How to ask the question and how to use a composite index like the HOI. And that's exciting.
You guys have me so jazzed because the real issue is creating more equitable outcomes, right? We want equitable outcomes. We want mortality rate to be low everywhere, right? If you've got an area where mortality due to breast cancer is low over here, can we lower it someplace else? And I'm throwing this question out to both of you. What is our responsibility as GIS professionals to make sure that the work helps create more equitable outcomes? And how can we influence that aspect of the work that public health professionals do?
So you want to be able to look at a number of variables to tell the story. So using the GIS, you'll be able to do, for instance, bivariant analysis through GIS to look at, let's say, heart disease and, let's say, poverty, to be able to map and see where they overlap. So looking at the population, where they are and what they need and what factors are actually driving the poor health outcome, and what policy or what interventions can we look at? We can look at the distance from where people live and where they get care, stuff like that. So all those things are some of the factors that you have to take into account in making sure that everybody has the equal access to health care, especially in the rural areas where access to care is very challenging. So in my work, I've been able to overlap different data sets like hospitals, FQACs, and then look at the outcome, look at the diabetes and other stuff to say, hey, somebody lives in here in this particular zip code or census tract. How far do they have to travel to get care in that particular census tract? And is it equitable? And the question is, what do you do? That's where the policy comes in. And we have, Virginia has been one of the states that we always talk about making things equitable for everyone. Everyone have access to equal opportunity in the state. And through GIS, work that we have been doing since I've been here for almost 20 years has always been making sure that everybody has equal access based on the data and also based on how we can display the data on the map so people can relate to the data on the map and come out with a policy to address the interventions.
Rex, when we started talking, you said your dad worked for the UN, and he started with this premise that the same problem existed decades after he started working on it. He would no longer have a job. So in Virginia, how do they measure the success of the Virginia Department of Health overall? What does success look like, and what are the metrics that they might use to show that GIS led to meaningful outcomes?
Absolutely. Because we are dealing with a neighborhood level, we're able to target the population. So we know where to go. And I'll give you another story too. I used to live in Northern Virginia, Fairfax area. And when I was moving to Richmond, a friend of mine, he said, don't move to Richmond. I said, why? He said, oh, there's too much crime in Richmond. But when I got to Richmond, he realized that he was actually looking at the data at the county level. So after a year, I called him back and said, look, there's no crime in Richmond. There's a crime in a certain part of Richmond. So using that analogy, that's the same way we build the HOI. So we're able to target the population. My Office of Health Equity, we have stakeholders in these neighborhoods that we work with to address these concerns. In fact, we realized that we used to have a higher infant mortality rate in certain part of Virginia. It's going down now because we are able to target this population and then come out with intervention to address what is actually driving the higher infant mortality rate or higher low birth weight. So GIS has really helped us to do that by targeting these neighborhoods and also addressing their concerns and challenges based on what you see spatially, because place matters.
Hey, just to kind of follow up with that, GIS allows me to have, whether it's stakeholders, policymakers, public health practitioners, it allows us to really answer very hard questions that we don't like to talk about. For example, let's just say one really serious public health issue is infant mortality. And let's say we have 5 census tracts of 5 neighborhoods that are right next to one another. And we have infant mortality. And somebody might say, well, we need to deal with access to care. But what happens when you use a composite index like the Health Opportunity Index and use GIS to figure out that while you have all of these, let's say, infant mortality, it might be bad in all these 5 neighborhoods, but they may be driven by different root causes. So the reason why that's important is because it allows those of us who work in public health, some of the factors that are leading to these poor health outcomes, the health departments don't really have the wherewithal to deal with. We don't deal with, for example, if the HOI index said it was, if it was, let's just say employment. We don't deal with that. Let's say there are environmental concerns. Well, we do have some environmental health folks and experts in terms of public health. What happens if the environmental causes beyond what the health department can do? Or what happens if it's spatial segregation, right? So the GIS gives the science base for you to compel the community and decision makers and other folks to sit down and say, listen, these problems didn't get here overnight, but we have scientific evidence that shows if not causation, we can certainly say there's a certain correlation with these health issues and some of these social determinants. What are we going to do about them? And it forces us to have conversations that we otherwise would like to gloss over.
That's so important, Chip. Public health agencies don't have unlimited time and they don't have unlimited money. They never have unlimited money. But with GIS, they can prioritize where investments go or where staff goes or where services are distributed. I think this is one of the most important things that GIS can do. I know there are thousands of applications of GIS, but what do you do when you don't have unlimited time or money to address an issue? And how do you decide where do you go first and what do you do first?
I would love to go to the ISRI conference this year because they're going to be talking about how to integrate AI into geospatial technology. So 2 things I got excited about. Rex and I had a chance to go to the ISRI conference about maybe a year and a half ago, maybe 2 years ago now, and they were talking about digital twins, which is the digital representation of the world using GIS. And I think that is so important because, you know, the biggest challenge for people who work in health equity is that when they talk about health equity, they talk about it within the context of a particular disparity. For example, we talk about health equity and birth outcomes, but we talk about it by reducing the infant mortality rate, which is, if we can do that, that's fine. But we don't necessarily visualize the world of what would happen. What would the world look like if we were able to achieve health equity for, let's say, birth outcomes that's not really concerned with making a modest reduction in that problem? And so the new technology, for example, like digital twins, would allow us to be able to envision what the physical environment would look like if health equity were to exist, in terms of social determinants, in terms of these things we call opportunity structures, which are the cause of the cause. So if you have an unfair opportunity structure that leads to poor social determinants. So to be able to use that type of technology to visualize what the future state would look like, because the hardest part about people when they talk about health equity is imagining what it looks like if we were actually able to achieve it. And I think the new GIS tools allows us to do that. And then I could talk about this all day, Eric. And then the last thing is they had this tool. It's a particular tool. I know others may have it, but it's called ArcGIS Knowledge. And what it does is it allows us to use graph database technology. And the reason why that is so important is because everybody has a system. And when you're dealing with GIS, it's usually based on maybe some type of database, or underlying geospatial database that you have. But the reason why I like the new technology is because you might actually have a business or a public health department or another nonprofit agency that has data. And because we don't always are able to connect to other data sources, there's a lot of good information that we're leaving on the table. The graph database of technology allows you to connect to different data sets as long as you know the relationship between different data. The reason why
there doesn't have to be one field in common between the two data sets, if I'm hearing you. Okay. Wow.
Correct.
Okay.
And what that allows us to do, is to uncover relationships or even solutions to problems that we didn't know existed because we couldn't connect all the dots. So those are the types of things that I'm excited about. And as an early adopter to all types of technology, you can't learn it all, but you can try to learn it all. Or if you can't learn it all, be an expert in it all, you can partner with people who are experts and bring them together to see how you can come up with new solutions that you didn't even think about until you start getting together with people with other skill sets.
Yep.
So that's how I got with Rex. Rex knew about the Health Opportunity Index, and it was a brand new technology for me. And because of our partnership, he actually changed the trajectory of my whole health equity practice. And it's that type of, because he knew GIS, but he had another tool. And it's about us connecting with people through GIS. Because when I used to talk about GIS to other folks, half of them couldn't understand or follow what I was saying because they were interested in mapping, but they really weren't into the spatial analysis. And at least, and Rex was on a whole nother level than I was. But because we had that thing in common, we were able to take GIS and then talk about the future of where it would take us. And it took us to actually developing a tool for the CDC on the national level. So, this new technology and these possibilities of existing technology, if you get with the right people, like a Rex and like a Erica Phillips, who knows what you can do.
Well, you are blowing my mind. First of all, you're taking me back to a question that I wanted to ask Rex, but I'm going to pull this all together. So, one of the things we often talk about on this podcast is that maps by themselves don't change anything, right? There are a lot of people who do beautiful maps, and I love seeing beautiful maps, but I'm more impressed when I see a map that can actually make something different happen. So when I hear you talking about the Health Opportunity Index and how new technology is going to make even the things that we've done that are pretty revolutionary go further, I'm getting very excited. So Rex, let me throw the question to you. What technologies are you interested in? What are you seeing coming down the pike? GeoAI or something else? What are you seeing that you think is going to change the work that you're doing to help you to see additional changes at the Virginia Department of Health and throughout the country? What are you seeing that you're excited about?
I think I'm very excited about GeoAI. I'm pretty sure that GeoAI can be the blind spot of ArcGIS. So I think that you cannot see this in Geo AI will be able to unveil some of these things to us and use the technology to be able to do a very complex analysis that we definitely need. So I'm very excited about that. I've not used it yet in my work, but I plan to do that very soon because I'm pretty sure that I can utilize that to do a lot of work that I do in health department.
I think some of GIS has become more democratic, right? We've got story maps and we've got tools that make it easy to collect information in the field, but some of GIS is really complicated. I'm hoping that Geo AI will make some of these tools more accessible to more people, because there are people who are asking the right questions, but they don't always have the tools to do some of that complex spatial analysis. So let's also talk about what's coming for the workforce, the geospatial workforce. So, Rex, some of our listeners are students or they are people who are new in their careers. What skills should they be working on to help prepare them for careers in public health or at the intersection of GIS and public health? What should they be doing to get ready to be the next Rex?
First of all, figure out and then whatever you do in ArcGIS should be guided by theory, and look at what do you want to do, at what level of analysis that do you want to do your project, whatever it is. So learning how to do, for instance, simple geo spatial clustering or autocorrelation or stuff like that, or using QGIS and all those things, skills are needed to be able to actually take a data and tell a story about it. If you can't tell a story about a map, and then people might not be able to relate to it. Because unlike having a spreadsheet that have over 1,000 records, you can use a map to tell a whole short story. And people can say, "Oh my gosh, this is where my house is. Oh, I know my neighbor's road. I know this road." So they can relate to some of these things on the map. So learning how to, first of all, understand the data and understand what the data is saying, and it should be guided by what you intend to do and the theory behind what you are doing. Don't just map the data, but understand what the data is trying to do. Because sometimes data in geography and public health intersect in a single truth. Or place can turn numbers into action. So having these skills to be able to take data and put on a map and tell a story about it and a narrative to your audience, those are the skills that you need to be able to do to tell a story about some of this stuff that we do on a map. So I used to tell my students, I say, look, if you can tell a story and come out with a policy to address that problem, then you should must not touch the data, because you say, and then what do we do? But any data you do, don't just do the map, don't rush to do an analysis. Take your time to understand the variables in the data and then figure out, how do I answer the question that I'm trying to, how to answer the question. So on the map, you do any map and a geospatial analysis, you'll be able to tell a story. But remember, that does not replace the community input. So the fact that you are doing all these maps, can say, oh my gosh, this area is so there's high poverty in this area. You need to be able to consult the community and figure out what is going on there. Or sometimes you might also get historic data to tell you what is actually going on. Because some areas might be just new area that you don't have historic data to back up what you are saying. So don't just interpret a map, but be careful that the data you have can tell a story, and also the community involvement is also part of what your narrative, so that you don't give any false narrative about the data.
I hope I haven't said this 100 times already on this podcast, but I may have. One of the most important lessons I learned when I was working overseas was nothing for us without us, right? So there are often situations where people come in and they think they know what's going on in a community or in a country, and they go, oh, we're going to do XYZ for you. And the people that I worked with said, all of this is great, but don't come telling us what the problem is in our community without first consulting us, right? Then absolutely. I think that's what you're saying, that you need community involvement. I've
Absolutely.
also heard you say, Rex, when you speak to your students. So that means that you are teaching also. Can you tell me a little bit about that work?
Yeah, I was an adjunct for VCU some time back, but I do get students who come to me for internship. So every
Okay.
year I get at least 5 students come to me for an internship to learn GIS and how to do spatial analysis and stuff like that.
So how do you approach mentoring others? How does that work for you and how does it work for the people that you mentor?
Well, I mean, I learned so much from them. In fact, I read a book. It said that the best way to learn is you have to teach someone so they can learn. Because exactly. So my doors are always open for students who want to learn more, and I can also learn from them. Health department has a internship program, and some of them are paid. Some of them are paid internship. So people can those who want to come and learn. I mean, I do have a lot of idea that I think I can impact on students. So anyway, my doors are always open, and I always welcome students to reach out to me if they have any issue that they're working on in terms of GIS. So I can always mentor students. I have a bigger room, so I can accommodate a lot of.
Well, thank you for providing that service to others because that's invaluable. So what keeps you motivated, Rex, when you're working on complex public health challenges? I have to imagine that at some points it gets frustrating or disappointing, but what keeps you motivated?
Well, what keeps me going motivated is the impact of the result, whatever is going on. So even though it's very complex, I try to make sure that whatever I'm doing has an impact on the population, not just do stuff because they are fun to do or not because they are fancy. But what is the impact that I'm trying to get out of what I'm doing? So the impact there, for instance, if I'm working in rural areas, for instance, what can I do? What can I show to make an impact on the lives of the people who live in these areas? So that has been very motivating for me. Also collaboration. I do collaborate with other. You heard Chip saying, Chip and I met almost about 10 years ago, and we have been working together almost all the time to work on this. So collaboration also keeps me going. It might be complex. I know who to call. I might not have all the answers, but I know who to call to get help when it comes to ideas. So those are the two main things that have really helped me to deal with my complex situations and complex analysis and stuff or challenging that I'm going through.
Okay. And what gives you hope about the future of GIS in public health? Where do you think we're going to be 20 years from now, Rex?
Well, I'm very hopeful for GIS because I'm pretty sure that GIS 20 years ago is not what we have now. Things are evolving, But I started using an Arc map. I did a 7 point something or 8 point something. And now we have Arc Pro stuff. So things are, but with all the new tools are coming out, incorporated into ArcGIS. I've always been talking about agent-based, where we have artificial world to create, let's say, for vaccination, be able to create an artificial world and say, look, simulation, and say, okay, if there's let's say, a flu pandemic, and there's only one person is infected, how is it going to disseminate through the population? So agent-based is able to do that. It's not yet in ArcGIS now, but I'm hoping that in the future, they can incorporate that model into ArcGIS so that people can actually do that type of simulation to figure out how disease like COVID-19 will spread to the population, in that instance. So hopefully, 5 years to come, I'm hopeful to see stuff like that in ArcGIS.
Agent-based different from digital twins?
Yeah, I think it's different. So agent-based, you create an artificial world, and then I used to learn in some ways because there's an out tool that can use to do that. And then you say, okay, if the one person has let's say COVID-19 in this particular zip code and go to school in, let's say, the zip code zip code in the other end of the city, and then we have people who so look at the mobility and how they're connected and do the simulation, we're able to tell you where it's going to converge. Yeah, so I'm pretty sure. So I'll look at that and see, but I'm pretty sure I'm hopeful that they can add it to ArcGIS and make our lives easier.
Okay. And my final question before we wrap up: Rex, what do you want from us here at North Star of GIS? What can we do for you and for the Virginia Department of Health? What would you like the listeners of the North Star Gaze to contribute to the work that you're doing?
Absolutely. I mean, health department always has a need for training for some of the new tools that come out in ArcGIS. Hopefully, some sort of training that can help some of the newcomers who are coming out, and those that are seasoned ones like me. I learn new things every day in ArcGIS. So, such a training, a resource that will help us to tap into in terms of knowledge. That would be something. So, North Star can be a very good source for us in terms of learning the new tools that has been incorporated into ArcGIS. So hopefully we can, Virginia Health Department can partner with the organization like yours to be able to do stuff like that.
Fantastic. I have to thank you so much for taking time for us today. I really appreciate your insights, your experience. You are a GIS professional, but you're a person who's looking at the big picture. You are looking at ways to really move the needle positively for those of our communities that are least advantaged. And I think that is work that is a higher calling. And I'm so honored that you took some time to share with us some of the work that you've been doing. I hope one of the things that you'll leave us with is maybe an example of a map that you created, or maybe an older map, maybe one of the maps that you created when you were looking at breast cancer incidents. I'd love to be able to actually show people some of the work that you've done. Would you be open to doing that?
Absolutely.
Share? Fantastic.
Some of them are actually, because I did a presentation on the APHS, some of them are actually online, so it's a public information. Yeah, so I can send those to you, and then and that was very informative to show that. Yeah.
Well, thank you again. Thank you so much for your time. I truly appreciate you, and I appreciate you, Chip. Chip had to step away, everybody, but Chip, I appreciate the level of people that you bring to the North Star Gaze podcast, and I'm grateful to both of you for participating. Thank you so much. If you like what you hear and you want to hear more, please join the Melanated and Mapping community as a paid subscriber. Also, we are looking for volunteers. If you're interested in learning how to produce a podcast or you're interested in being on air, please get in touch with us at info@northstarofgis.org. Thanks for listening to the North Star Gaze, intimate stories from geoluminaries. If you're inspired to advance racial justice in geo fields, please share this podcast with other listeners in your community. The intro and outro are produced by Organized Sound Productions with original music created by Kid Bodega. The North Star Gaze is produced in large part by donations and sponsorship. To learn more about North Star of GIS, check us out at northstarofgis.org and on Facebook or Instagram at GIS North Star. If you'd like to support this podcast and North Star of GIS, consider donating at northstarofgis.org/donate. Or to sponsor this podcast, email podcast@northstarofgis.org. You've been listening to the North Star Gaze.